organize their notes and things. We were just discussing uploading this to YouTube. I'll go ahead and share my slides. So for any of you who have never been to our sessions, we generally start off with a quick who we are, how we got started, what we're doing, how you can get involved, and all those little good things. And then I'll go ahead and introduce Dr. Christine to talk about whatever she has in store for us. So I'd just like to say thank you so much for joining. This is Pre-Health Shadowing, and we're an international, student-led, minority-led nonprofit for medical advancement. I'm going to go ahead and kind of explain some things, but before we do that, I do just want to say that we do have closed captioning. Should be a bottom button, maybe it's on the side. Wherever you have your Zoom bar should have that information for you. If for some reason that's not working, you can always email us at info@prehealthshadowing.com. Don't forget to save us as a contact to keep us out of your spam. You can always join our email list for other future sessions, and you can also join just to ask us general questions, or if you need the transcript, or if there's anything that you think that we can improve on, and we're always great and excited to see that and have more ideas that people share. So again, if you want to stay in our loop, we do have our email list, but you can also follow us on social medias. We have Instagram, TikTok, Twitter. We also have LinkedIn, and we have YouTube. All of those channels we update on a daily, weekly basis, so you can always be up to date on all of those if you need to. So since we host everyone from international areas, we always ask where you guys are calling from. Our headquarters are over here on the West Coast. I'm in Los Angeles. So if anyone wants to kind of drop that in the chat and say where they're from, you're more than welcome to. If you don't want to, then I guess that's up to you. But it's always nice. Ooh, some Bay Area, some California still people, New York City, Mississippi, Colorado. I know that Dr. Christine's in Carolina. Texas. I'm sure there's plenty more. I always love seeing people international, so that's always fun. I'm sure the time zones are wonky and weird, so they'll probably be watching this recording. So if you're interested in being a part of Pre-Health Shadowing, we do have a volunteer portal on our website. If you just go to Pre-Health Shadowing and then get involved, and then you can send an application in. It's a very quick application. It'll probably take you about 10 minutes. Let me go ahead and mute people. It is 100% remote, and it's flexible to your schedule. You can do a wide variety of things as a volunteer. You don't necessarily have to be on the shadowing team. That's the people that volunteer for helping host. But if you don't want to do that, there's always website design, coding, all of that stuff that if you have a skill for, we'd love to see some time from you. So you can also apply to join our leadership team if you want a few more hours during the week. I know that our volunteers, we have anywhere from however much time you want to donate. The leadership team is a little more dedicated. You do spend a little bit more time doing that. I'd say about 5 to 7 hours a week. It is 100% remote. You can stay up at 2 in the morning getting your hours in if you need to. We do have various roles in this department, and if you notice at the end, it says "and more." We do have leadership roles that you can kind of create and match with whatever skill set you want to be a part of. And so maybe that doesn't fit in any of these roles. And if it doesn't fit in any of these roles, you're more than welcome to kind of create a role for yourself and explain a need or why that role is kind of a perfect fit for pre-health shadowing. So there is a link. It'll be sent in the chat, but there's also the link at the bottom. All of our pages are through prehealthshadowing.com. So you can always just go to prehealthshadowing.com and just look at the tabs. There's that many of them. So I always recommend people just go and search around. And also, if you're a high school student, we do have HTP. It's our high school training program. It is for high school students. There is another way that you can join and start a college club as well. And that's also through a training program, and it can help you set up, similar to the high school training program, a club of sorts or a program within your school that helps other people gain healthcare education for people who are before college or people who are in college. It depends on the program that you want to go and are you're interested in. It is an interest form on our website. It'll be posted in the chat. And if you have any interest in doing that, you can also reach out to info@prehealth shadowing. We're happy to answer any of your questions on that. It is a fully training program, and we do help you establish the club or the program within your high school, and we help you through the different caveats of how things fit or what you would be doing, so that you don't feel as though you're signing up for something and then you're going to have a ton of tasks on your own. You do have a lot of people in this program that help you navigate challenges and any kind of thing that you can kind of think of that comes up. So one of the things that we have been trying to push for is diversity talks or panels. We do want to start having more panels, especially over the summer. So if you know someone who's inspiring to you, who has kind of shaped your definition of diversity, because I know many of us have very different definitions of diversity, and whether that's racial or LGBTQ plus or sexism, anything that I don't know, makes us who we are and makes us a diverse culture. If you know someone that's inspiring, you can nominate them for a future panel, or even nominate them to be shadowed. If they're in the healthcare field in general, not necessarily MD, PhD, you can always still nominate them, and then we can see how they fit and what meetings that they can kind of run or join. So if you have anyone in mind, that's awesome. We'd love to hear about them. Lastly, we are a completely free and accessible program, and in order to stay that way, we do run off of donations and the time of our volunteers. So if you can't donate, you can always donate your time. But if you also can't donate, you can send the QR code or the link, and that'll be in chat, to anyone that you think might be interested in our program or able to donate, maybe that are looking for nonprofits or charities to donate to. So if you do know anyone, great. If not, it's fine. We're happy with even sending a dollar. A dollar from everyone would help a ton. So thank you so much. We'll keep going. Type your questions into chat. I know that Dr. Christine knows that there's a Q&A at the end, but sometimes our co-hosts or our hosts go off the rails and they answer questions midway through. Regardless, if you don't want to do that, we will be keeping all the questions off on a separate document, and I will be asking those at the end. So if something gets skipped, I will also make sure that it will be taken into account. So you can always just post those on chat. Don't worry about them getting lost in all the comments. I will keep track of those. So we will have a Q&A at the end, though. Take good notes. We do have a post-shadowing assessment. Well, that's harder to say sometimes. To earn your digital certificate that verifies your hours, that it does need to be completed to verify your hours. And in order for you to say that you did do the 2 hours of shadowing, you do need a certificate. And if there's any problems with that, feel free to email us. I will have a short presentation at the end on how to take that presentation or take that assessment, and you will see how that all runs. So if you can turn your cameras on, I know there's a few people with their cameras on, but I always like seeing faces. Faces always make it seem a little bit more like we're in a panel or a room together versus all sitting on our beds. Without further ado, though, I would love to welcome Dr. Christine and see what she has to say about everything.
Does that look okay to you, Kara?
It's still doing that slides thing.
Okay, give me a sec. I know we figured it out. Hold on. We've just figured it out, so.
I know. It was so perfect before.
Now?
Yep. Perfect.
Okay, good. Okay, thank you.
Christine.
Thank you so much. Well, thank you all so much for having me today, especially on a holiday, Memorial day. So thank you for being here. And of course, anytime I get the opportunity to help support budding healthcare professionals, I always want to be as supportive as I can, because I would not be where I am today if it wasn't for the support, mentorship, which we'll talk about, the importance of the experiences that we get that build us to where we're supposed to go and where we're led. So thank you for having me today. I wanted to share about not only what I do clinically, but really what I have learned is a lot of what I do as a physician is advocacy, which leads to leadership. And it all plays a role in the everyday clinical work that I do. So I really wanted you to think about that today as how significant being a physician is, but it's really because I do a lot, all of us in some capacity are advocating and leading in some capacity in our roles every day. I am a professor of family medicine at Campbell University School of Osteopathic Medicine here in North Carolina, not too far from Raleigh, which is our capital. And I am the director of a palliative care geriatrics program, developing that experience for our students, but also we have a residency program. So I do a lot of education and training and also interprofessional. I work a lot with the PA students, social workers, and nursing students. So really kind of an interprofessional approach to what I do every day. So I wanted to tell you a little bit about my background. I think it's important that you always reflect a little bit of where you started, because it will take you to where you're supposed to go, and don't forget your roots. And I know sometimes it can be hard because you're so early in your stage, but every chapter takes you through your journey is important stepping stone for you and a learning opportunity. I was very fortunate. My mom was actually a single parent, and there was 3 of us. And I'll be honest with you, when I look back, I don't really know how I had this audacity to think I could become a doctor. It's not like we had any doctors in the family. My mom is a cytologist, so she looks through slides through microscopes. So she would take us to work with her sometimes because of lack of childcare. And that's where I met her colleagues, which were doctors. And one of her best friends to this day, Barbara, but she was a pathologist, a doctor. And I just loved her. I thought she was the coolest woman ever. And when I got to know what medicine was and just this curiosity about medicine, and now just so you know, I'm an 80s kid. So this was really at the height of the AIDS epidemic. My mom was with a lot of colleagues and friends in that space during the AIDS epidemic. So I learned a lot about suffering, but also heard and understood about advocacy. And so I think it was just a combination of all of that, of thinking about my role as a future doctor, and that I could be, how I can play that really advocate role, not knowing that word at that time when I was a young child, but understanding that I could take care of my patients, not only at the bedside, but also relieving of suffering, and also in another way outside of the clinical space, doing fundraising. I would see and witness. I witnessed that. I witnessed my mom's colleagues doing supportive groups and things like that outside of the clinical work they did. And so I guess, again, to really think about, I was very fortunate that I had those experiences, and I never knew otherwise that I wasn't going to be a doctor. Even though I came from such a single parent household, I know the hard road it is ahead for you all. And I want to tell you, if your heart's in it and that's where your passion is, you're going to get through it. You just have to understand the support and resources along your way to get you through that part. So I went to the State University of New York, Public School of Albany, for undergrad. And I was very fortunate. Again, I had exposure to friends who had parents that were physicians. One in particular, my friend Stacy, her dad was an osteopathic physician. So that was the first time I was introduced to osteopathic medicine and got to shadow him. Had opportunities to do, we had called 5 Quad, and it was an EMS service, and it was run by undergrads. It was a really cool, fortunate experience that they trained us to be EMTs. It was a course, it was free. It was amazing that I got these opportunities as an undergrad. A lot of what you all are pursuing. I was a CNA, so I became a nurse aide, St. Francis Hospital. That was what I did for a couple of years during my undergrad and when I graduated. amazing experience. I always tell y'all, it's really important to get that bedside experience. If you're interested in medicine, you really need to understand what it is every day your patients are experiencing, because if you don't understand the hands-on care it takes to care and treat them, I think it's going to be really a missing piece for you as you become a physician. And of course, research. I hear that all the time. It's the same thing that you're all experiencing. It's kind of like your checkbox. And, looking back at the time, like, oh, I had no interest really in research, and I did the lab research. But to be honest with you, what I do today, a lot of us, we do research. It's not, for me, it's not in the laboratory. I do a lot of what's called quality improvement. So research can look very differently, and you can, again, make it very relevant to the work, your clinical work. And so I want you to be open-minded when you do these things that sometimes you feel like you're going through the hoops. But to be honest, now that I'm faculty, they're helpful, enriching experiences for you to really think about opportunities for yourself. You may be exposed to things you never, ever would think of that would be something interesting and meaningful to you. And maybe laboratory, research is something that you never realized, wow, this is kind of cool. I can really think about that. So all that to say, I understand the experiences that you're looking at and pursuing. There's a reason for it. It is helpful in experiences, and you never know that next door it's going to open for you. And so all that to say, especially for me, the shadowing the osteopathic physician was it blew me away. It was everything that I thought being a physician was. It's caring for my patient entirely, not just their physical ailments, but their psychosocial, everything that matters to them in their everyday life, their family unit, et cetera. And so for me, that's when I was really, I really understood I wanted to be an osteopathic physician. Also, during my time working as a CNA, I got really close to, you're part of the nursing staff. So a couple of my friends, one of them in particular, a wonderful nurse, her husband was a osteopathic physician, but he went to a medical school I was not familiar with, LECOM, Lake Erie College of Osteopathic Medicine. And so again, I was very fortunate that during my CNA experience, I was able to meet a DO and learn about his experience, what his schools, where he applied, et cetera. So again, be open-minded to some of these experiences. Don't think of it as just something to check off the box. Really, really, really take a deep dive into it. Take ownership of the patients you serve. Really make it a really impactful experience for you, even as your CNA time. It's so important because it is so valuable what you're going to learn, and it will always be with you. There's still experiences I look back 25, 30 years ago for real, and I will never forget it. It was some of the moments were life-changing for me. So I want you to just go into all these opportunities wide open, because you just never know what it's going to do for you and how it's going to shape your career. So like I said, that's where I learned about LECOM, Lake Erie College of Osteopathic Medicine. Otherwise, I grew up in New York. So for me, I was going to go to NICOM. That was going to be my school. But I have to say, when I did my interview at LECOM, first of all, it was beautiful. It's overseeing the Lake Erie in September. It was gorgeous. So for me, I was not aware of the winters, but it was beautiful. And it was a smaller school experience, was something I realized coming from an undergrad of huge undergraduate student body. I knew for medical school for myself, I wanted something smaller. I wanted a more personalized experience. And my friend, the DO that went to LECOM, he kind of sold me on thinking about LECOM, even though my family's like, what? Aren't you coming to New York? Not to say, again, you have to kind of know what's most important for you. For me, I wanted a smaller school experience. And so that's why LECOM was the perfect fit for me. So just think about that too. I think we're very fortunate. We have a lot of DO schools now. Think of Campbell. Campbell is an amazing school. I've only been full-time faculty for 2 years, but I've been very impressed with what it offers our students. Wonderful, smart student body. I mean, our future is so bright with y'all. So definitely be open-minded to exploring outside of the state you're into. So all that to say, when I went to LECOM, I'll be honest, I loved medicine. Every class I loved. I thought, oh, I would do this. I would do surgery. I would do ortho, do neurology. And when it came down to it, I decided family medicine. It hit everything I was looking for. It was being really up to date of all of medicine, having the opportunities to do technical things such as, that's the one thing about family medicine is you got to do stitches and incisions and different cool kind of things like that. And so that's what attracted me to the field. But I also, again, love the whole family-centered care. I loved delivering babies, caring for moms and babies through the end of life. And so that's what sold me on family medicine. It really is really what I was looking for in medicine. And I always thought what being a physician was for me. I was fortunate as a LECOM student. I did my clerkships. So your third and fourth year of medical school, you do rotations, you do clerkships. You're out on the floors in different, every month you're in a different department, whether it's surgery, neurology, family medicine. You get time and opportunities to really experience each specialty. And I did my clerkships in Pittsburgh. It was about 2 hours, and that's where I lived for my third and fourth year of medical school. And again, was very fortunate. Amazing city. I never knew anything about Pittsburgh till I lived there. It's a wonderful city, so much to do, but UPMC, University of Pittsburgh Medical Center, is one of the top in the nation in research and medicine in general, a lot of different fields of medicine in UPMC. So it's something that definitely keep you open-minded is about UPMC, where I did my family medicine residency. I was at UPMC, St. Margaret, and a wonderful experience, a lot of opportunities to grow as a physician, family medicine, but really I started thinking about, I wanted to do more. I realized when you're a resident, you take care of a lot of geriatrics, older population of patients, no matter what you do. You're the bulk of the patients we serve are geriatric patients. And that's when I really had an influential mentor to really have me think about really focusing on geriatrics. And so that's where I was thinking about fellowship training. I also got a lot involved in leadership. This is where I was elected chief resident of my residency program. It was an amazing experience. It showed me, and had opportunities to learn and develop how to be a leader in medicine. I had opportunities to participate in system-wide, hospital-wide committees that I'd never, such as peer review or some of the committees that this healthcare system had a resident leader on to be part of the decision making, whether it was changing the EMR system down to how they're going to restructure some of the inpatient teams, et cetera. And so that's where I really had an eye-opening experience that, one, I love this work and I actually could be a voice at the table. And I never thought and imagined myself in that kind of opportunity. And then also in medical education, when you're a resident, you get opportunities to work with learners, medical students, residents, fellows, and I loved it. I loved the opportunity to be able to really train people to see the work that I do and to really get opportunities to spend time with medical students earlier in their career. So again, this kind of really helped me think about academic medicine and to think about that as a career. What made me think about geriatrics again was my mentor, but that's when I started exploring fellowship training. It's a year of extra training after residency to become a geriatrician. And so that's what, after I was finishing my residency training in Pittsburgh, even though there's a great geriatric fellowship in Pittsburgh, one of the fellowships I applied to actually was in UNC Chapel Hill, Carolina. And so that's what brought me down here to North Carolina is I did my geriatric fellowship training. It had, again, things I was looking for. I wanted more mentorship in leadership. I wanted mentorship in being in more of an academic center to think about pursuing a career in academics. And this program offered that, offered more like a faculty training route, and also some research experience, which you definitely need, obviously, especially if you're thinking academic medicine. So that's what brought me down to do my fellowship training. I was very fortunate. I loved geriatrics. I think if any of my students would tell you they rotate with me, they have this really unexpected, wonderful experience. I hear it all the time. There's just obviously a lot of ageism in our society. It is a joy to care for this population. It's also intellectually so challenging in medicine. It is one of the greatest challenging. They're such complex medical conditions. We learn medicine on more middle-aged people. If you think about it, when you go through training, when you go through any pre-health training, whether it's PA school, medical school, we learn evidence-based. But when you look at a lot of the studies, the populations I serve are really not part of the studies. You know, when we treat high blood pressure, heart failure, any of those conditions, all of the evidence majority are looked at younger population. And I say that because you need to understand, to care for an older population now, we're extrapolating that kind of data now and applying it to an older aged population. The aged body ages differently than when we're younger. So there's a lot of physiologic changes that happens normal naturally as we age. And it's also our older patients do not present the same way of diseases that we generally know how they present. And that's what makes it challenging, but really interesting medicine, if you like that. And I tend to love that. I think it's really, and it's satisfying. This is a population that really you're establishing such long trusting partnerships and relationship. Our seniors love having that continuity of care. They will be honest with you, and I love that. I appreciate that when our older patients feel the communication is not well for them. A lot of the times my patients are very honest with that. And I love their stories. I love the wisdom that our older patients can provide for us on how to be better physicians. And so overall too, they also have a lot of different perspectives. Remember, geriatrics is usually from 65 all the way really to end of life. It's that advanced age to end of life spectrum of care. And that's why I love it. I literally can care for my patients for years, even decades, if you think about it. And I love that continuity, and to be with them as their goals change, to always remind me that a lot of their goals are to have improved good quality of living, even through the end of life. And I love that. I love the fulfillment I get from caring for this population. And so that's how I kind of, and that's what I did my years at UNC. I was faculty in the geriatrics department. During my time in geriatrics, I was fortunate again to have mentorship to really understand palliative care. This may be a term some of you may not be familiar with, some of you may know. Palliative care is caring, it's serious illness. You're managing it's a medical specialty. So it's a fellowship. I did not have to do a year of fellowship at the time. I did extra training for palliative and hospice boards. Now you have to do a year of fellowship training to become a palliative care and hospice physician. But you're caring for patients with serious illness, again, through end of life. And that's where hospice is more at the end of life. If you think about geriatrics, it truly is a spectrum. You can care for patients for decades through the end of life. And that's where palliative care and hospice comes in. It's that end of care spectrum. But you have to understand, as a primary care family physician, I cared for 40-year-olds who had serious illness and realized the importance of palliative medicine, that I had to be skilled in caring for my younger population as well, who had serious, chronic, debilitating illnesses that shortened their life as well. And that's where palliative medicine helped me, again, do better care, is that I learned about prognostication. I learned about better symptom management for my patients, whether they're getting aggressive cancer treatments or heart failure treatments. This is where palliative care takes care of even younger patients with serious illness. So again, when you think about it, it's really the spectrum of care. What I loved about, and again, why, if you think about the all-person care, we are what's called 4 dimensions. We are not just the physical, we are the psychosocial, spiritual parts of us. So we are it's called 4 dimensions. That's really what, again, the philosophy of hospice is. But again, I look at it as with geriatrics too. And if you think about that philosophy, if that is something that's really inspiring to you and what medicine is and should be, these are the fields of medicine that you would think of, the 4 dimensions of who we are, and to manage those. That's that medical specialty. And again, hospice is truly the end of life care. You're maintaining that dignity. You're ensuring your patients are respected and valued. It's this really holistic approach. where you care not only for that patient, you're doing so much support and care for their families or caregivers and friends. And you're empowering them with information to make the best decisions for themselves, particularly at the end of life. And so that's what I really started focusing more was palliative care and hospice care. I really, the last 12 years have focused on that aspect. I remained as faculty for about 7 years at UNC, and it was really becoming difficult for me. One, I was a new mom. I had two young babies. I have two children. I didn't feel, I always describe, a peg, trying to fit in. And I realized for me, I was really experiencing true burnout. And I always speak to learners about burnout. I think it's important that we talk about it and we destigmatize that. But it was the first time because I experienced it again. But I felt overwhelmed. I felt I did not have, for me, the mentorship that I needed more to pursue a full career in academics. And that's why I felt for myself, I needed to find somewhere that I could do more the palliative hospice care aspect that I wanted to do, but also that I could balance work life better for myself and my needs at that time. And I felt at that time it wasn't going to be in academics. So I was fortunate. I was able, there was a hospital system here in Raleigh, Wake Med Hospitals, and they were building a brand new palliative care consult service in the hospitals. And that's what I did the past 10 years. I built up that program, built up an interprofessional team, and was able to actually stay involved in teaching. I think we always need to be mindful that we always think academics is the only way to stay in teaching. It's not. There's so many great ways to teach, whether it's interprofessional students, it's to our colleagues. You'll get invited to speak at civic centers or community centers, church communities. Again, I always tell y'all, when you become a physician in particular, you will always be recognized as a leader. And that can be defined in any way. In your community, you're a leader. In your hospital system or your practice, for example, you can be identified as a leader. And those are opportunities to share with people your not only the work that you do, but sometimes they'll ask you to present work on, how to complete advanced directives is a topic I get asked a lot, for example, or how to age successfully. That's a common question I get, for example, if the church is here. So just be open-minded that teaching can look a lot different. And I realized I got the joy of teaching that I didn't have to stay in academics to do that I felt the joy of teaching in different ways. And it was meaningful to me too. So be open-minded. Teaching can look differently. So don't think that you have to stay in academics if you don't feel that's where you belong, or maybe not at that moment. Like myself, I was at that moment in my life years ago, had to move in a different direction. And so that's where I learned that teaching can look differently. That's where I take the leap of faith. I always say, I thought I was going to always be in academics. And here I am now at Campbell. I'm back in academics. I'm older and wiser, but also feel very supported by my deans. I came back full-time to full academic. Again, I'm a professor here 2 years ago. So it's been 2 years. I've been back in more of a full-time academic system. But again, I feel very supported. I also know I had to learn what burnout felt for me. I had to learn what my boundaries were so that I knew when I was feeling that or when I could push back. And again, I'm saying this as someone that's more seasoned in my career, and I feel empowered to do that. I'm not saying it's going to be easy when you're early career, but I do want you all to think about, I want you to always be true to yourself about what you can handle, what is comfortable for you, and what can meet the needs that you want to find meaning in the work that you do. So all that to say, you never know where you're going to end up. And I'm very fortunate that I'm back. I'm here now in Campbell and love working with the students and get that opportunity to work with them. So this is kind of where, again, where advocacy, service, and leadership. I think when I think about why I chose geriatrics and palliative care and hospice, I always feel like I had to be the voice of my vulnerable populations. When I was a resident, I saw the mistreatment of a lot of our older patients when they came to the ER from these nursing homes. There was no one there to voice and advocate for them. And I think that was always the driving force for me. It was always the passion to speak for vulnerable peoples and populations, to reach out. And that's always been my really underlining of the service I do, and even the leadership roles I do. I always say we all feel we're overcoming the imposter syndrome. I want you to always know that. We always kind of feel that way. But when someone taps you on the shoulder and sees something in you that you may not recognize or see, take them for their word and take that opportunity. You're going to be approached on ideas or thoughts or projects, or to be part of something that you never imagined, because you are dealing with this imposter syndrome. And it's the nature of the field that we're always having to be in the mindset of comparing, right? I know, even not you all, an undergraduate, I get it. But I want you to help yourself kind of, if someone is giving you an opportunity because they see something in you, then follow that, because you never know what it is that is about you, that authentic self of you, and the roles it can provide for you. I never thought in a million years I would serve on the North Carolina. I served the past 6 years on the North Carolina Medical Board. That's a governor appointed. Our governor appoints the medical board members. Never in a million years. But I saw things over 6 years ago. There was laws being implemented in our state that was going to affect my population. And I just couldn't sit there, and I said I had to do something. I had to be a voice, and that I was appointed to be on the medical board, and my last year served as president. Never in a million years that I ever envisioned that for myself. But my point being, I was always true to what I do for my patients. Aside from hoping I do good care for them at the bedside, I have to be the voice for them. And that continues to drive me forward in the work that I do. To me, it's a service, and it's a form of advocacy. I'm now at the national level. I'm on the board of directors of our Federation State Medical Board. I get the opportunity now to be a voice for my populations that I see in rural North Carolina, but I get to be their voice for them at the national level now. And again, don't ever underestimate what your passion and drive can bring you to do to move forward. I think if you're always true to yourself and what you're doing at the end of the day and who you're serving, you will always be given a path. And there's wonderful friends and colleagues and mentors that have brought me here that I never in a million years would have ever envisioned. So I want to make sure you think about that and always have that for yourself. Oh, okay. Oops, sorry. I wanted to, one thing I learned, especially during the pandemic, it was another time that a lot of us burned out I was again, front lines with my palliative care team in the ICU with the ICU teams every day. If you think about the work that we do, we care for patients with serious illness and end of life. And if you think about how COVID was at that time, especially the first year and two, we were frontline workers with the ICU team, and I burned out. Like everybody else, our learners were no longer there. Our med students could no longer be there to rotate and spend time with us. And for me, I realized that was really, because it was meaningful for me, it actually helped me prevent burnout actually. And so it's important to know what's important for you, aside from your family and your friendships, the things outside of work that are so important. You have to keep that important and a priority in your life. I'm very blessed. I have a wonderful, amazing husband, and my children are my biggest supports and fans that keep supporting me in things that I get invited to do. But also, with that said, the work that you do, you want to think about things that keep you doing what you're doing to minimize that threat of burnout for yourself. And for me, that's when I realized education was important, to get back into that education. That's where I went back to Campbell. Again, it could be anything. It could be mentoring others. It could be serving in any aspect of medicine, and even outside of your work that you find important work and meaningful. So that's where I want you to think about that. Everything you do can be a type of service, and lead to a leadership in the field if that's something you find really important. So just be open-minded. You never know where your path will lead you with these great opportunities. And again, if someone taps you on the shoulder to consider something, think about it. It may really open a lot of doors for you. I want you to think about this. I'm sure a lot of you know Brene Brown. A lot of her words are so true for us in healthcare. Authenticity is so important. It's really, really this daily practice of letting go of who we think we are. Don't put yourself, like I said, think of that slide I had of there's circles, right? And the peg that doesn't fit right. In my early career, I burnt out because I thought and imagined something different than being true to myself of what I loved. And that's what I want you to always think about for yourself. Just be true to who you are and the work that you do. Yes, you're going to have to go through some of the same stepping stones that a lot of us, like I told you, a lot of you have to look at some kind of clinical work. I was a CNA, a lot of you do that, EMS. You do need to have those exposures of hands-on care for patients. It's really important to understand the needs for the patients, every patient. It's important to get exposed to different types of extracurricular activities and opportunities. So I say that, yes, I know that there's going to be things that we all just have to kind of go through to get those experiences. But at the end of the day, just be true to yourself. I truly, honestly am sincere about the authenticity of all that you are and what you bring. There's only one you, and we need you to serve in medicine if that's the path you choose. So I just want you to always think about that. I know there's going to be some ups and downs, but I always want you to, at the end of the day, that's what it's about. Okay. I wanted to end. This is a dear friend of mine, Pat. She actually, when I was a geriatric fellow, so that was 2007, long time ago for a lot of y'all babies. I actually took care of her husband who had dementia, and he ended up dying from dementia. So I had the joy and pleasure of working and taking care of him for 7 years before I left UNC and went to Wake Med. And to this day, we are friends, dear friends. She and I do regional presentations together. We have a conference we're going to present together in September. She's a strong advocate, and we do a lot of mutual work together to support each other. And I just adore her. And I say that because you never know, again, what your patients and families will teach you. They sometimes are our best teachers at times. And she's always teaching me, and I just adore her. She's become such a dear friend. So I was in the note on Pat, my sweet friend, Pat. So I'll end with that there. And Kira, I'll stop sharing. Is that correct?
That works. Although I love that picture. That's a great picture.
Isn't she fabulous? She just turned 90.
Oh my goodness.
Yeah, she's fabulous, but that's what I'm saying.
Speaking of volunteering, I volunteer at my local hospital, and
Wonderful.
I had another patient the other day, 102.
Oh my gosh. Isn't that amazing? I know.
She couldn't lift her arms anymore, so she was a feeder patient. But oh my gosh, 102, I can only imagine.
Yep.
I'm sure we're all slowly getting into the hundreds.
Yeah. Oh yeah. I know with my med students, I'm like, oh, I'll be like, oh yeah, this patient's only 70. They're like, only. I'm like, y'all, you're going to be seeing 90s and 100-year-olds. This is only 70. Yeah. They're so funny. It's their perspective is like, only 70. They're kind of old. I'm like, oh no, you guys don't understand. So when they spend a month with me, they're like, oh wow, you're right.
Do you have an age that's been like your youngest, and age that's been your oldest?
Well, I mean, again, I'll see my geriatric clinic that I was building at Wake Med. It's really for people who have memory concerns. It's basically kind of like a dementia clinic essentially, but I see people and they're like 60, which is concerning if they're coming in for me for memory concerns. So I have to do a full workup. So that's about the youngest. I don't do general family medicine right now anymore. I just do geriatrics, palliative care, and hospice care. And then like to you, my oldest is like 100, 102. That's my oldest patients. Wow. Yeah, it's pretty amazing.
So one of my bigger questions has always been burnout, but I think you talked about that enough. So my second question is kind of, and I know that you briefly mentioned different clerkships and how you kind of spend a little time in different departments. Was there any departments that while you were going through your clerkships that you kind of liked along with family medicine? Or maybe you started off and you weren't going family medicine. How did that route kind of take you?
That's a great question. I loved OB-GYN, obstetrics and gynecology. because I loved, again, I think a lot of what I loved that eventually I ended up family medicine is doing a lot of what's called anticipatory guidance. You get to spend a lot of time with the patient, especially when you find out they're pregnant. You do a lot of the visits before they deliver. And then when they deliver, I love the time to teach them about what's coming next. Okay, next month, you're going to start seeing these changes, and this is normal. Expect this. Like, I loved that aspect of it. So that's why at first I was like thinking about OB-GYN. And I love, again, I like procedures. That's why I like with gynecology, OB-GYN, you're a surgeon. So I loved that aspect of it. But again, I always got drawn back to older geriatrics. And I think that's where I kept thinking, I think family medicine, because the anticipatory guidance, how to communicate to your patients so they know what's going on, they understand what's going on. That is a skill set we all need to learn. We all need to teach our patients about their disease, how to care and manage it, what to expect, especially in family medicine. And that's where palliative care and hospice, again, is a lot of the skill set. It's teaching people what's to expect or coming next, how we can help support you, how we can manage things. And it's that constant education and continuity of care is what I loved, and ultimately brought me to family medicine, especially because I love the OB-GYN part. So that's really ultimately, I was really open-minded going into clerkships. Like I said, I loved surgery was my first rotation as a 30, and I was like, oh my God, I love this. But the hours were not. I was like, yeah, no, no, thanks.
Yeah, I've definitely heard a lot of people going into med school, and everyone says keep an open mind, but there are a lot of
Yes.
people that kind
Yep.
of say, oh no, I'm clearly this, and then they end up
Yeah,
in
no.
a complete different.
Yes, all the time. I see it all the time. I honestly, and I love, of course, when they're like, I want to do fellowship in geriatrics, or I want to do fellowship in hospice and palliative medicine. Of course, that I love that. Like I have one of my mentees now, she starts her fellowship next month. So I love that. You just never know. You never know. And then be careful too. I'm like, is it because I love the attending, or is it the actual work? So that's what I always had to be careful too. Like, could I get up at 2 a.m. to do this or not? That's how I knew if I really loved something or I just love the attending and the experience. So that's what you got to think about.
Yeah, and then the other big question, and anyone else is free to answer throw some questions in the chat. DO versus MD is the hot topic,
Mhm.
especially nowadays. And you mentioned more DO schools becoming certified to have teaching classes.
Oh yeah.
Is
Oh
there any
yeah.
kind of, did you go through the MD DO? I know that you were open-minded about
I
it, but
did. Now this was way back when. Oh, okay. So what's different now is, again, I don't even want to say how when I applied to med school, it was like 1998. We had to take the different. So when you look, because you all are looking at not only schools to apply to, you're already looking ahead of, okay, if I get into the med school, what opportunities will this school give me? What kind of research, extracurricular, rotation experiences, and then board passing rates. That's what you're going to be thinking about as you're applying to medical schools. Okay. The next thing is they have now a lot of the residency programs are taking. So when you go to the DO school, we had to take a separate board examination than the MDs. We had to take two. We had to do step. Okay, so you guys know that. I don't know how much. Okay,
I know that.
now we are so fortunate now. You don't have to take both exams. You can take one. If you're a DO, you can just stick to our step. Yeah. So that's what's great about where we are now, that I feel like there's a lot more opportunities and choices for you all as learners if you're interested in medicine. That MD and DOs, to me, I didn't feel like I've had any less opportunity as a DO than my MD colleagues. And I think now more and more so, and a lot more specialties have accepted how well DO schools are, just as our MD colleagues are. If even more, we're trained more. We get more musculoskeletal neuro training because we do osteopathic manipulation. So we do the manual. I love it. Even my population, I can minimize pain. I can increase range of motion and function. I love that. That stuff is everyday stuff. My patients, like, that's their daily life. They just want to be able to have better function and a little bit of decreased pain. So if I can do that, not prescribing a pain medication, that's where we have a little bit not more skill set. So that's what I love about it. So all that to say, you all in a lucky time now where DOs are known, and now we have studies to show that we are equally as qualified, if not more, and the opportunities are just as wide. I'm chair of medicine at Wake Med. I'm the first DO in that role. I was the first DO when I was faculty at UNC, and now a lot of our Campbell students are UNC residents and are staying on there. So all that to say, we've come a long way, which is wonderful. So it just opens the door for y'all for more opportunities to apply for schools, whether it's MD and DO school. And it's more about what you want. If you want more research heavy, it may be some of the bigger MD programs. If that's not kind of your way and you want to do, and again, if you have more of a holistic perspective of medicine, which that's definitely my vibe, obviously my field, then maybe think about more applying more to the DO schools. But yes, I did both because we didn't have, again, this is a long time ago, there wasn't as many DO schools either. So you guys are a very great, fortunate time. There's a lot more opportunities. So apply to both if medicine's your interest, for sure.
And then one of my other questions was going to be, I know you mentioned surgery, and you kind of started that and then you were kind of interested in it, but then you realized the, I don't know, the daily life or
Lifestyle.
yeah. So
Yeah.
what would you say your lifestyle is like? Like you're just kind of day to day or maybe week to week. I know some people have
Mhm.
very altered schedules,
Yeah,
but
it is. So I'm a little, it's a little bit different right now because I am building two programs. I'm building up an inpatient palliative care consult service. What I'm no longer at Wake Med, the hospital in Raleigh that I used to work at. I'm in Harnett County, which here it's a rural underserved where Campbell is. So if people are interested in more rural underserved caring for those populations, definitely again think of Campbell. There's a lot of opportunities for that. Anyway, we have these two small little hospitals. So I'm trying to build up that program. So I'm there about 4 half days a week. And then 3 half days, I'm building a geriatric clinic in Raleigh. So right now, my days are a little bit structured, like 4 full days of work, clinical work. And then my teaching is usually Fridays. Then we do a lot of hybrid. So we don't always, when I'm doing a lecture, sometimes it's just Zoom. So I can do it from, if I'm at the hospital, I can do that, or we can record it. So we don't have mandatory attendance at Campbell. So I don't always have to be in person. Of course, I prefer that, but so it makes it flexible for me to be able to do my didactics if I have to. And they're planned out like almost a year ahead. So I'm able to accommodate if I need to be on campus all day. Like we had an event on Monday or graduation, I just block my clinic schedule and I don't go to clinic. So again, I'm very much in an environment where I can have that flexibility. One, because of where I am and I'm a little bit more seasoned. So I have a little bit of flexibility to block some of my schedule to meet my education needs when I do that. So very flexible in a sense, which is great for quality of life. And for my kids thing, I don't miss any kids thing because I can go block half a day and go see my kids' event or pick them up early if I have to. So very fortunate that I can do that. That's a great question, Kara.
I know a lot of people that frequently ask how you found mentorship
Mm-hmm.
or that or
Yes.
research in general as well.
Yes.
Is there any kind of tips and tricks do you
Yes,
have for
I
that?
think one, I love the question. I think it's very important. Even myself, I still have two very important mentors for me. I always tell my learners, no matter the stage of career, you need mentors. And it doesn't always have to be medicine. I have one, Dr. Caprillion was my mentor when I got my master's in health professions education as an educator. She taught me so much about curriculum development, gave me honest feedback that I needed to be a better educator and professor. My non-clinical mentor is Mr. Tom Mansfield. He's the CEO of the medical board. He's an attorney by trade, but he taught me so much about other leadership skills that I need to continue to be successful as a leader in medicine. And I say that because be open-minded. It's not always necessarily going to be someone in your field of medicine. Of course it is, But there's going to be someone you meet like, oh my gosh, they are exactly what I've been seeking for this gaps in knowledge or skills that I don't have, especially if it's in advocacy or in leadership. We don't do a well enough job. That's something I'm very adamant about. We need to do better to empower our learners and med students on taking on more of those kind of roles, because we need to start pushing back in medicine. We cannot have laws made without us involved in them. We can't have healthcare systems and insurance companies deciding what medicine is, the practice of medicine is. That's our role and our job. So in order to do that, we need to feel empowered. So all that to say, and there's and feel empowered to go and up to someone. I love when a student comes up to me. I actually get disappointed when students don't come up to me when I learn that, oh, this student is interested in geriatrics or palliative medicine. I'm like, I wonder why they didn't reach out. Reach out, just send an email. I'm so interested in your field. I love that. That brings me such joy when I hear from a student. I've just had a first year email me, and I'm like, where's she been all year? Like, I felt bad. Like, and I'm so glad she did, because I'm going to get her involved in a research project with me. It's just a quality improvement work, but it's going to be important for her. She'll get to spend time with me in my clinic. So reach out, because your faculty, that's what they're there for, or professor that you really feel like, wow, they are exactly what I'm seeking to learn more in this space, to learn more in this field, to do more of this work. So reach out and just be honest. I love to learn more how to do the work you're doing, how you got to where you are, and help participate or support some work that you're doing, volunteering. And believe me, I feel bad when students don't do it. And I wish I felt more empowered to do it. So just ask when you meet someone that you're like, wow, they're doing work that I'm really interested in. They'll definitely, if they don't have the bandwidth, they can't do it, they're going to connect you with someone that will. Cause I know I've had to do that in times where I'm like, I can't right now, but let me connect you with so-and-so, and then I'll regroup with you in a few months. So ask. A lot of people love to help students and to get you where you are. That's a great question.
Yeah, I hear that one a lot. I know that you, and I was gonna skip it over, but burnout wise,
Oh yeah.
do you have a recommendation? Because I know you say kind of find your bounds so you know when to push and when not to push.
Yeah.
But I know you took some time for your burnout, but did you
Yeah.
have anything that, I don't know, significantly helped you? Like maybe it was an activity or a sport, or did you think moving around was better?
When I left UNC, my first burnout experience, because that was a different experience, obviously, than pandemic experience. Well, one, again, I was very fortunate. My husband's amazing and supportive. And I'll tell you, besides his support and like, you don't just seem happy? Like, this doesn't sound like, and he did all that he could to help me. Like, again, we do a lot of hiking. We're very fortunate. We do a lot of activities with children, and that was so important. But I had a patient, I actually wrote about this. This was on a WebMD article years ago, 2013. One of my favorite patients, Mr. Young, he actually had an appointment with me to see me, and I just saw him. So I'm like, I don't know why. I was like, oh, I hope nothing's going on more serious for him. He actually made an appointment just to tell me, Doc, you got to go. He saw, he said, your spark is gone. You basically, like, this job's killing you. And Pat, the pitcher, she was another one. She said, Dr. K, she said to me, I'll never forget it, and that's why I adore her. She said, you're too ahead to where they're ready for. She always saw that about me. She said, you're too far ahead and forward thinking than where this institution is, and you're never going to fit in. And I was blessed with wonderful patients that just told me that was my breaking point, that they saw that I did not belong. I was struggling. And I say that because our patients see things and pick it up. And so that's when I left UNC. And I owe it to her. I owe that so much to Pat. We always kind of joke about that she's always like, oh, there's that vision again, because there's projects we're working on together. And she always says that about me. But I was fortunate that I have a supportive family, and I am a woman of privilege. I know that. I call that out. that I could walk away, that I have a dual income household, my husband and I, dual income, that we took a leap of faith that I was going to just quit my job, not having a job backup, that we were going to be okay. I'm also obviously white woman, middle-aged, higher, educated, higher income family, that I could easily walk away. And I acknowledge that. And so I say that because I know it's not always easy for my younger colleagues to walk away if they're struggling. But I also know that we are doing what we can to do better job supporting each other, to see how to change the system and our work environment to minimize burnout, because that's ultimately the problem. It's the systems breakdown, and we need to look on each other and support each other. And I think there's a lot more, not only national movements doing it. I know at the state level in North Carolina, that's a big priority for us. But I know even in the systems, we're doing better job supporting each other and recognizing when our colleagues are struggling. So again, I feel like we're in a great place now, better. And even the med students get lectures and didactics on burnout, moral injury. That's something that I call that out. That's when we're in a system where you can't do the care that you can do. And so that's important that you all understand those terms now, because in medical school, they teach that, which is wonderful. I didn't even honestly know what burnout was. And when I left UNC, like that's not I'm not even kidding. We don't even like use that term. It's very shameful. So that's why now I talk about it, because I want people not to be shamed about it. And I was lucky. It led to where I was supposed to go. And my path forward, I never imagined. So it worked out for the best for myself.
I have another question on, and one of the things that I thought was also amazing, because you were talking about burnout, is bedside manner. You talked about that a lot, and I have seen more and more pushes for bedside manner, and so I'm curious to see how they adapt medical classrooms and stuff to kind of accommodate that. But with that, you also mentioned stigma, and especially around the older adult community. And so I was wondering, is there a best way to kind of, because I know that you're dealing with patients' families and things with that being a prevalent issue as well. Is there a way that you kind of, I don't know, control those situations or get around it? And what would you recommend?
So when you say the family members sometimes over talking past the older patient, like situations like that.
Yeah.
Yeah, that's a great,
you could be with your grandparents, and sometimes I feel as though that's a stigma that we always have to kind of dance around.
Yeah, that's again, such a great question. So ageism obviously is very prevalent, and especially in medicine. And in fact, a lot of the work I'm doing is correcting ageism, because I'll see patients, Carrie, you mentioned earlier your 90-year-old or 102-year-old couldn't lift her arms. And it made me wonder, like, why? Because just because you're 100 doesn't mean you can't lift up your arms, unless she has some kind of like terminal whatever. I don't know. But
she fell down the stairs.
She broke her neck?
No. Oh. She just temporarily couldn't use her arms.
Okay. And
she thought it was hilarious too.
Oh my God.
So I was like, oh, okay.
Oh my God. And I say that because I've had patients misdiagnosed or underdiagnosed or not diagnosed with a serious illness because there's a lot of ageism. I had an 80-year-old. He couldn't lift his arms. Y'all, just because you're 80, you should be lifting your arms. So anyway, all that to say, I have to do a lot of, to your point, advocating on behalf of my patient, who for the most part can make medical decisions themselves. And I'll have like an adult daughter there, an adult child with their parent at a visit, and they're trying to make decisions on behalf of their parent. And I'll have to say, okay, I hear where you're coming from. Let's pause a minute. Let's allow your mom, who's able to make decisions and is very clear what her goals are. Let's have your mom share more with us why she's making these decisions. Because often it's fear, right? It's all out of love and fear. Often the adult children say or want to force their parent to do something or to undergo a procedure, and the parents, no, I don't want to do that. And when you sit down and the parent's very clear what their goals are, they love their quality of life. The fear is if I undergo a surgery, it can change my quality of life. And there's truth to that. We're putting people at risk that maybe if they go under surgery may change their independence. There's real truth to that. And so I say that I have to sometimes be the voice and advocate on behalf of my patient in a very respectful way, of course, but so that the adult, children, or family understands where the perspective is. We are younger, so we may pursue very aggressive medical things, right? Because surgeries and aggressive medical care was meant for younger, healthier bodies, relatively, right? It wasn't necessarily meant to be for the 100-year-old that may not do as well and may have more complications and risk of death sooner if they undergo procedures. So I take that time to advocate on my patient and to share that perspective so adult families realize, okay, my mom loves us. It's not that she's doing it because she doesn't love us. It's because she loves her quality of life and wants to keep it and maintain it. And so you do a lot of that. You do a lot of kind of facilitating conversation, especially in hospice care, right? There's that my patients will say, I think I'm dying. The family I think my mom's not going to make it out of here, i.e., I think she's dying. And so I have to facilitate that difficult conversation and bring them together. And so we do that. You get trained on how to do that. How do I navigate that? How do I do that delicate balance? How do I bring in the families together to facilitate this conversation? And that's a lot of the training that you get learned is how to do that work and advocate on behalf of your patients and be their voice. In geriatrics, I do that a lot with other specialists. I'll have specialists that will disregard my patient's symptoms. And I have to be like, hey, just so you know, this is not normal aging changes. She needs to be seen again, and we need to do more of a workup. I saw that with oncology a lot. I had to send a patient. I told the oncologist, this is an underlying malignancy until otherwise, because this is not normal aging. And that's a lot of what I do. I have to advocate for my patients and do that work. So again, it's an avenue of advocacy, obviously, because there's a lot of ages in medicine, and you have to do a lot of that facilitation for your patients. I hope that answers your question.
Yeah, it does. Very beautifully. No, you mentioned having kids.
Mm-hmm.
Did you ever have moments where it was a challenge to kind of organize your personal life and your work life? I know that you said you have a flexible schedule, but
relatively, yeah. Mm-hmm.
Yeah, but
Yes.
for anyone that's kind of, I don't know, trying to do this, but also has kids and thinks that they can't do it, do you have any advice for them?
Yeah, another great question. I also want people to know, and I say this because I had a young colleague of mine. She was a nurse practitioner I trained and worked with for a while. She made a comment that her time wasn't as important as mine because she wasn't a mom. And I want to correct that. Your times are so important and valuable, regardless of your family unit. You may be a caregiver for a sick parent or a neighbor. You may or may not decide to have children. So I want you all to think about our time is difficult regardless. So I always want to think about that too, that it's not just about being a parent. Again, I'm fortunate that it's busy. You have to have a good calendar. We're very fortunate. My husband and I, we literally plan ahead, months ahead. And that's been very successful for our family. And also, again, I'm very empowered that I will tell people, I'm sorry, I can't do it on that day. That's my son's graduate. I just had a meeting come up and I said, I'm sorry, my son's graduating on that day. He's an 8th grader. I said, I can meet 8 a.m. or on another day if it's important to have me there. Otherwise, I'm happy to follow up. So I do other ways to show that I'm just as committed and dedicated to the work, but I'm also going to prioritize my family, especially these milestones are so important. It's not worth missing. And if they want me to be there, they accommodate. If they don't need me there, that's great too. And I will follow up. So I'm a voice. Again, I'm empowered because I'm more seasoned, but I want you all to know that your time is valuable. And if people want you there, they're going to work and make it work for you and seeing how to balance that. So just be honest with, hey, I have a family commitment on that day. I'm happy to meet early in the morning. It's usually Zoom. That's what's great about it. Or is there another time that works for everybody? Or I'll do a lot of my lunchtime. I'm fine to do that too. I'm fine committing to other time during the day. if it's to respect my family time and my family unit. So I do a lot of that to balance everything. Yep. You guys,
Also,
I love these questions. It just shows how forward thinking you are already. That's wonderful.
and then I know that you talked about single mom raising you and kind of navigating that. I also grew up in a single parent household, so
Oh,
I know that role.
yeah,
I know a
really
lot of
hard.
people talk about the finances and financing
Mm-hmm.
med school. Did you ever
Yes.
have a point where, since you were raised in a single family, I mean,
Mm-hmm.
3 kids too.
Yeah.
Actually, I also have 2 siblings, so
Really?
similar setup.
Aw.
But is there anything kind of advice for those people? Because I know that a lot of people feel as though if they can't fund it, they're not going to do it.
Yeah.
And we had a few people on other sessions that kind of instead that. So
Yeah. Yeah. So I'm going to be honest with you. The cost burden is a lot more now for y'all than, again, I always knew I'd take out loans. That's how I went through undergrad and then medical school. But it's more astronomical now. And I probably would have considered looking into PA school too. PA school is a wonderful profession. It's you get your master's, it's half the year, but it's still very similar training. Like again, I do a lot of training with PA students. They're wonderful and very, very talented, but it's 2 years. So the loan burden is a lot less, obviously. And I know a PA, she's an amazing leader, Mia. She just finished writing a textbook. She's a leader in advocacy with her medical society here. So all that to say, you could still do this other really meaningful work if that's what you want. You don't have to be a physician per se. If you want to do the clinical work and still get other opportunities, whether it's research, leadership, advocacy, you still can do that also in these other fields. Again, I'm saying PA schools because I do a lot of PA education and work with PAs, and it's 2 years compared to what 4 years of medical school is. So a lot more affordable, relatively speaking, without loan burden. All that to say, there's a lot of great options now, especially again, during my time, we didn't have it, but now they do a lot of loan forgiveness. If you're willing to work in the underserved for a few years, especially if you pursue primary care specialties, and that's aside from family medicine, I think it's like pediatrics. There's other under that umbrella of primary care they'll do loan repayment back. Look in those programs now because those are going to be like the med schools you want to look into in the residency programs that you're going to want to be interested in pursuing to get that loan repayment, which is amazing opportunity. And I would do that too if I was where I am now. If I was a student, definitely pursue that.
definitely great advice. I didn't even think about PA school.
Yeah, it's fantastic. There's a lot of great like we have 7 PA programs here in North Carolina alone. So again, very prestigious career, longevity, a fraction of the loan burden, relatively speaking. So definitely something to think about.
Yeah, definitely.
Mm-hmm.
When you were starting off in med school, do you wish that you knew anything before going into it? Like if you could look back on your younger self and give yourself
Yeah.
some advice, what do you think that would be?
Um, Another great question. Um, and I know you and Kara could talk separately about how difficult it is growing up in a single parent. And I don't know where you are in regards to, I was like, I have a twin sister and a younger brother. So kind of the oldest. No,
I
you're
have
not
a
a twin.
twin sister and an older
No,
brother.
stop. Oh my God. So like my sister and I, like, so I become like a parent. When you're a single parent household, one of you becomes the parent. So anyway, all that to say, um, I, so the clinical stuff I felt great about between being an EMT, my years of a CNA, I had a lot of skills and bedside manner already. Like, so I went in actually very strong, well above and that's why I rocked like clerkships. I rocked it because so that aspect I felt, I mean, very strong, well above a lot of my classmates that never did that kind of clinical experience. And I can tell students now, I can tell the ones that did clinical work and ones that have not had that experience. You can just tell. But anyway, all that to say, so that part I felt great about in med school. I felt really good and actually felt because I did, phlebotomy, like I did all those skill sets working. So I was very strong going into it. It was the other non-clinical stuff. I didn't have like I didn't know what mentors were. Like, I didn't have that. I didn't per se, like, I didn't know what it was to have opportunities to, do abstracts, research like that. I never had that depth of, like, the research I did never led to presenting at a conference or something. It was never to that level. Um, so when I was a med student, I wish I had those kind of opportunities. Because again, you feel like it's imposter, like I didn't feel like I belonged in medical school because you met all these people that had those opportunities or had all the stuff on their resume and did all this other stuff. And I was like, I didn't have that. But that's okay because you get those opportunities in med school. And that's what I try to tell my students their first years. I'm very lucky I get to meet with first years. I meet the kids that didn't get those opportunities for one reason or the other. And I worked a lot too. I was also working just to be able to apply for med school. When you're a single parent household too, you don't necessarily have the resources. So I was also, any free time I couldn't do, I never traveled. I never left, I never had those. People do missions trips and things like that. I never had those opportunities. So I felt like I was at a disadvantage, but that's okay. I had other life experiences and I get to travel now with my husband and kids. Like, I'm very blessed we get to travel now. That's something very important to me, my husband, that he never had those opportunities either. So all that to say, I felt at a disadvantage going in. To the point though, you get those experiences as a med student. So I don't want people to feel like they're at a disadvantage. That was just, again, my imposter syndrome, feeling that and not having those experiences. But you will get those experiences in, whether it's PA school or med school, those opportunities come to you in graduate school level like that. So, but definitely do the clinical stuff. Definitely helpful. Definitely.
Yeah, we had another professional that said that there's four legs on your chair and you need to meet all four legs to be an amazing applicant. And he talked about that. It's pretty much all clinical stuff, and one of the legs is like hobbies or something that you're
Yeah.
passionate about.
Yeah.
So I
Yeah.
definitely highly recommend that to everyone I meet.
Yep.
Um,
Exactly. Yeah.
Before I do my wrap-up slides or complete those wrap-up slides, I was wondering if you had a favorite case, some positivity to
Oh
end
my
our
God.
session.
In the sense of,
Maybe like your favorite connection or some case that was, I don't know, very different. Yeah, I know you mentioned some doctors who would just kind of dismiss, like, oh, they're just old. So maybe
oh
you
my
have a
gosh.
case
So
like
I'm
that.
not trying to be corny, but honestly, every day I have wonderful experiences. But I will share one that um, years ago when I was more early doing hospice care. That's when, again, I know people are like, oh, that's so morbid. So, one, you're all in medicine. You're going to be caring for patients that die. So, we all do work with death and dying. And I'm just fortunate that in hospice, you get training to do it well and you get a team approach to do it. So, anyway, some of the joys that I have seen in hospice care, there was one I'll never forget. It was an estranged daughter. Her dad was my patient, and we had no next of kin. He was in the hospital, and I admitted him under me to care for him at the end of life. And he started, people often, obviously, when they're dying, they do life reflections and they talk about their regrets, right? We get these opportunities, and we work with a spiritual care counselor that works through that with us, and my social worker. That's what we do when we work with end of life care. And my wonderful social worker at that time, Murray, was able to track and find this daughter that he had such regrets about, reached out to her to see if she'd be willing, and knew, one, her dad was at the end of life, understood that even, we don't know what those dynamics are. There's a lot of pain and sometimes trauma in people's lives. So I understand and get it when someone doesn't want to see that parent or that closure or that loved one. I get it. I totally get that. But in this case, she said she wanted to come and make amends with her dad. I'll never forget, I got chills. She came in and she was at his bedside for 2 days. It was laughter and tears. It was forgiveness. and love. And I'll never forget it because I felt like even at the end of life, we still can make a difference. We still can make an impact for people to their very last breath. And that was such an amazing story because it changed her life. She said she was so grateful that she had that opportunity and that it was always going to be with her, that she got to really make amends with her father at his end of life and to be there at his last breath. And so don't ever think the work you don't do is even no matter what it is not important. That connection was so valuable and important. And I'll never forget that. I always wonder how she's doing and wonder where she is, because that changed her life. That end of life moment for her changed her life. And I know the rest of us, it changed our lives too. So we say we're doing care for our patients, but honestly, a lot of times they're teaching us and doing well for us how to be better people. So I always want you all to think about that, what a noble profession medicine is, and that we're always learning from our patients. And that story, I'll never forget that one. So kind of a sad note, but
I mean, sad and nice at the same
yeah,
time.
right? It's one of those.
Yeah. I always tell people that you get the sad cases and you get the happy cases, and
Yeah.
you got to go through both to.
It's true. You're so right. But I'm not kidding when I say in geriatrics, it is a joy every day. Oh my gosh, such great stories. My patients are appreciative. They just love that someone listens to them. So um, always a joy to take care of them.
Yeah, I used to volunteer at a retirement home in high school,
Oh,
and it was amazing how many people were just happy for you to just sit next to them. And
yes,
that's
just
all
to
they
be
needed is
present,
just,
right?
yeah,
It's
just someone
true.
sitting next
Just
to
to be
them.
present. Yeah. Yep.
They just need a living body.
They want someone there present just to be there and that they matter. It really matters for all of us, that validation of who we are. So, yep, for sure.
Yep, definitely. And hopefully other people all get on the
Yes,
volunteering train, because I love it.
exactly.
It's
Yep.
amazing. So I'd like to thank you, Dr. Christine, again.
Yes, thank you.
I loved your presentation and everything you had to share. I
Thank
will
you.
start opening up my slides. Hopefully everyone can see them and there's no issues there. So one of the things that we oftentimes recommend is reflecting on every single one of your shadowing opportunities, whether that's in person or online. And we have three main questions that we say that you guys can answer, that you can add more to them as you go. I know that I have a few different personalized ones as well. And it says, what brought you to session today? What are your three major takeaways that you got from this presentation? And what do you want to learn more about? Maybe this is a field that you're very interested in, and maybe it's not a field you're very interested in, and you can kind of make comments on what you liked, what you disliked, and see what's a good fit for you. Because I know that the medical field is home to hundreds of different concentrations, if not probably up into the thousands now, because we have so many different ways that you can specialize in these fields. And so one of the things that we always recommend is these reflections, and mainly because if you do start applying, or I know a lot of you have probably started applying because applications have opened, they do say that they'd like to hear from you in regards to your meaningful moment or what you really got out of shadowing. And so if you make all these reflections, you can always look through them and say, oh my gosh, this one I loved, and have something already kind of pre-written so you can add to that. So I highly recommend doing it. It takes a few minutes. You don't need to do anything major, but also, if you want to share those highlights, a great way to branch out and kind of build your network. I know it's not what you know, it's who you know is the slogan that I've heard a lot this past year. If you want to share those on LinkedIn, we actually will repost those on our website, assuming that they're thought-provoking and you didn't spend 10 seconds on them. So if you do want to do that, we are very happy to repost those and kind of share your thoughts on session. You don't need to put your certificate like this picture. You can if you'd like. Some people don't want their full title on there or whatever it is. But if you wanted to share those, you're welcome to. If you don't have a LinkedIn and you do want to still share that, you can also email us at info@prehealthshadowing.com, and we're happy to post on your behalf. And sometimes those end up on our website as well. So again, if you're interested in being a part of our pre-health shadowing nonprofit, we do accept volunteers. It's 100% remote and it's flexible to your schedule. If you can only be on at 1 in the morning with your busy schedule and you only have an hour to spare every week, then by all means join. See if you can interact with some people and build your community. I mean, besides the volunteer aspect of it, I love the community that we have here and I love all the doctors and the people that we meet. So I highly recommend even just reaching out for information. We are always happy to give that. Lastly, if you can donate, we're always happy, even if it's a few dollars, even if it's just passing the QR code around. If we hit enough people, we'll definitely get some donations. And if you can't donate that, you can donate your time. I'm always looking for volunteers. Fill the pipeline. So last but not least, everyone always expects to hear about the certificate. You do get a certificate that tracks your hours. It is 2 hours. It's 30 minutes for the quiz and an hour and a half of session. You just need to go to the prehealthshadowing.com for the course page for the professional. And so then you just go to that course page. It's a 10-question multiple choice quiz. Sometimes there's two false in there and sometimes there's multiple choice in there. You have two chances to pass with 70%, which should not be hard, assuming that you paid attention and you kind of jotted some things down, you should get 100%. But 70% is the gold standard. The quizzes are open indefinitely, so if you don't have time to take it today or right after this session, you can always take it tonight, 2 in the morning. I always highlight that. Everyone always stays up late nowadays. Or you can take it next week or next year. We do have 200 or so sessions on our YouTube and on our website. And those can also be watched and the quiz can be taken and you can get certificates through those. So if you're looking to accumulate a bunch of hours this summer, that is a great way to accumulate a lot of hours. We are recognized as well, so it's something that you don't have to worry about not counting. I do know there's some very sketchy online shadowing websites. So if you have any questions about that or you have any tech difficulties, feel free to reach out. Last little thing, tidbit, step number 3 is you do need to click finish this course to download your certificate. And sometimes there's this banner at the top of our website that covers the finish this course. It will be at the top very right corner of your class. So you can go ahead and just press that. The quiz is uploaded right now, so don't worry about any chaos. But if you have chaos, feel free to email us. If you did miss any part of this session and you don't think you'll get a good grade for it, don't worry about that. We will have this recorded and uploaded. Hopefully it's uploaded in the next 24 hours, but it's usually uploaded within the next 2 days. So you can always visit our YouTube channel. You can go watch that. It does take a little while for it to download off of this session, but we do try to have that up as soon as possible. If any of you need an email or some kind of notification that it is up, you can feel free to reach out to us and we can organize that for you as well. So be sure to catch our sessions every week. I know we have a couple of them coming up. We try to fill at least one a week. Sometimes we have 2, unheard of having 3, but sometimes during COVID, we had sessions almost every day. It was crazy. But thank you so much for joining. I'll see you next time. This is Pre-Health Shadowing. And if you have any questions, I will stop the recording, but I'm happy to answer any questions regarding the pre-health shadowing or anything that we do. So have a good one, guys.